when it comes to intra-arterial lytics and delayed reperfusion, because as I mentioned, one of these additional reperfusion efforts, which one can do, is to go in again with a microcatheter and then give additional intra-arterial lytics. So we wanted to take a look, because we already had some data, and we wanted to take a look how do these intra-arterial lytics correlate with the delayed reperfusion, persistent perfusion deficits, right? And what we did, we took our registry, and then we saw that about 10% of our patients receive additional intra-arterial thrombolytic urokinase after we observe incomplete reperfusion at the end of the thrombectomy. But this is not a standardized thing, so this is mostly interventionalist based, and it depends on the treating interventionalist decision, right? And so far, there have been some trials like PROACT 1, PROACT 2, MELT, and of course, the recently completed CHOICE trial. All of these trials investigated the effect of added intra-arterial thrombolytic after mechanical thrombectomy. And so the results, we wanted to see how would our results, but the thing about these trials is that they all assessed early reperfusion, so not delayed reperfusion. What is early reperfusion? So after giving intra-arterial thrombolytics, you wait for about 20 to 30 minutes, depending on how long does it take. And then again, while the patient is on the table in the angiography suite, you then again do the angiography imaging and then see if there is an improvement in the TECNO score, in the recognition. But none of the trials really investigated the concept of delayed reperfusion. So what happens in 24 hours? We couldn't find these results. And we thought it might be interesting, given what everything is happening in the world, and given that there are several trials right now at the moment investigating intra-arterial lytics and secondary mechanical thrombectomy. And what we saw, it was, in short, that there was an effect of intra-arterial lytics, in our case, the urokinase, on delayed reperfusion. Those patients who received intra-arterial thrombolytics, urokinase, would be more likely to develop delayed reperfusion as opposed to the persistent perfusion deficit. And we think it's really important because in order to get the full concept of how would an intra-arterial lytic or how would any additional reperfusion effort, either anti-thrombotic or secondary distal mechanical thrombectomy, have full effect on the patient, and how would that matter for the patient outcome, we think it would be worth analyzing that in a more of a broader spectrum, because if you just give it 20 to 30 minutes and evaluate it, then I'm not really confident that you can get the whole effect, especially because the preclinical studies on intra-arterial lytics and urokinase in our case have shown that the full effect of thrombolytics is seen only when you observe it within a 24-hour window. So that's exactly what we did. And then we saw that there was, in fact, a correlation between delayed reperfusion and intra-arterial lytics. And as a next step in this project or in this avenue, we will try to replicate our results, which we saw from our observation retrospective cohort, in a randomized controlled trial. And this randomized controlled trial is the TECNO trial, which we will be running in Bern, and it's a multicenter trial, which will compare Tenecteplase versus best medical treatment as additional reperfusion effort for incomplete reperfusion. And currently, we are enrolling patients throughout Switzerland, and we are looking to expand now in Germany, France, Belgium, and Finland. So, but basically, the premise of this trial would be to see how these intra-arterial thrombolytics, in this case, Tenecteplase, would actually benefit on both early but also delayed reperfusion.